So, good evening, everyone. Thank you for joining us at the Economic Research Council. It's actually our first webinar of this academic year. So, welcome and delighted to be here. We have today, it's a real privilege actually for me to introduce Professor Martin Powell. Really glad he could join us here today and really looking forward to hearing his talk. He's a professor of health and social policy at the University of Birmingham and is also the editor of Social Policy and Administration. He brings a wealth of knowledge, topics like consumerism in healthcare, decentralization, historical dimensions of healthcare before the NHS, really vast experience. We've just been chatting in the before everyone joined, and it's been a delight to connect. He's going to talk for about 30 minutes, and then we're going to have an opportunity for Q&A. Please do engage actively. So submit your questions via the Q&A function at the bottom of the screen, and I will try and curate at the end. Without further ado, it's great anticipation. I welcome Martin to share his valuable insights. Over to you, Martin.
Okay, well, thanks for inviting me. As you see, the title is a question that, for those of you with long memories or read history books, Prime Minister Callaghan was meant to have said, although apparently never did. The idea crisis, what crisis, comes from about the mid-1970s. But we're going to apply that idea about crisis to the National Health Service. David's kindly agreed to do my slides to me. So if I say next slide, please, that's not part of the presentation. That's simply advice to David to change the slide. So next slide, please. Okay, so the starting point is it's been said many times that the British NHS is in crisis. So this is a quotation from an editor of one of the leading medical journals. And as you can see, he's very fond of the word crisis. So, I'll just go through and read it just to give you an idea of how many times he says it. I'm lost count, to be honest. But so the NHS is in crisis. Some call it a humanitarian crisis, others call it a political crisis. Whatever your interpretation, it's still a crisis of funding, a crisis of bed shortages, a crisis of under-provision in primary care, a crisis of crippling demand, a crisis in social care that creates a bottleneck, a crisis of flow, a crisis of common sense, and perhaps a crisis of failure to find alternative phrases as well. So clearly, at least one person thinks the NHS is in multiple types of crisis. So next slide, please. However, that word by itself doesn't really tell us very much because we're not quite sure what type of crisis it is. And just to add to this confusion, in recent years, people have started coining other crisis-related terms as well. So the ones I've come across are mega crisis, meta crisis, and I think the word of the year for one of the dictionaries a few years ago was permacrisis. So, lots of variations on the theme of crisis. Even more complex is, according to some people, the NHS has always been in crisis. This is a quote from Nick Timmins, who's probably one of the most perceptive observers of the British welfare state. Nick written a wonderful book called The Five Giants, which if you haven't read it and you're interested in the British welfare state is definitely a must read. So Nick was a previous journalist, so he's been around, he's covered everything, and as he says, quite important to know that virtually every day since 1948, when the NHS was founded, the NHS is said to be in crisis. And for the last 75 years, morale with it has invariably never been lower. So what's new about crisis, given that some people say that the NHS has always been in crisis? So next slide, please. And this is my contribution, not quite as elegant as Nick's, but if we keep using the word crisis every time we have a problem or every time there's a policy we don't like, then does the term crisis actually lose its currency and value? Final introductory point is that some couple of years ago now, the House of Lords had an inquiry into the NHS. And again, it started off saying the same things as Nick Timmins. The NHS has survived a long series of crises since its foundation. However, and they never actually explained what they meant by this, but this crisis is different from other crises. So what we're going to do in the remainder of time is do two things. Basically look at parliamentary debates, one in particular, and look at occurrences or counts. You know, how many times does the word crisis appear in Parliament when talking about the NHS? And also do something called framing, trying to say how crises are framed. So two different ways of looking at crises using parliamentary debates. So next slide, please. So the starting point is that in the academic literature, there are many different definitions of crises. One starting point is that some people regard crisis and disaster as roughly the same sort of thing. But even within the word crisis, there seem to be two very different approaches to what a crisis is. And this is oversimplifying a little bit. But firstly, the term crisis is seen as a problem, a significant problem, a major problem. So the sort of terms we have found in the literature there are policy failure, policy disaster, policy fiasco. You know, so there are whole books written about those type of failures, disasters, and fiascos. So in the first sense, crisis is just seen as a major, perhaps long-standing, long-lasting, difficult to resolve problem. The second type of way of looking at crisis is as a critical juncture or turning point. Now, I don't know how good people's, I think it's Greek. I'm not quite sure how good people's Greek is. I went to a comprehensive school, so we didn't do Greek, but as I understand it, this is the sort of medical use of crisis or traditional medical use of crisis. A fever is seen as reaching a crisis point in which basically it either gets better or it doesn't. So in this sense, crisis is a critical juncture or that turning point that you see in sort of the medical literature. So it's not only a problem, but it's a problem that leads to a sort of solution or resolution. So we've got crisis by itself as a problem, and we have crisis linked with a solution. And in addition to that, of course, there are many possible indicators or measures of crisis, as we'll see when we look at the debates in a few minutes. The next slide, please. Going to introduce the sort of theoretical or conceptual perspective of framing. And basically, you know, problems, issues tend to be framed. In other words, people can see them in different ways. So you might frame something very different to how I might frame something. And one of probably the best and most quoted definitions of framing comes from 1993, and that really involves four types of elements. So it's something to do with a problem definition, a causal interpretation, something to do with moral evaluation, and or a treatment recommendation or solution. So we're going to bear those in mind when we go through and look at the parliamentary debates. So next slide, please. So what I'm going to do in the remainder of the time is to explore crisis in the NHS from one parliamentary debate in the House of Commons. So we're going to use two sort of approaches to this, two different types of content analysis. Now, in some ways, this is sort of using academic language to dress up something that's very simple. Quantitative or basic content analysis is simply to count. So, you know, in the old days, you know, before we had IT, before we had PDFs, you would, you know, you'd look at the printed paper and you would go through and you'd actually count, you know, from number one, go the right way through. Of course, that's a lot simpler these days. And when you see the number of times the word crisis has occurred in the NHS, I'm very grateful that we've now got IT that does it for us. So first of all, simple counts. How many times does a word occur? Different form of content analysis is called qualitative content analysis. So really that introduces the idea of framing, the one we just looked at. So that looks at how crises are framed in sort of more suppose, linguistic terms and simple counts. So, I mean, to oversimplify again, we have almost a quantitative approach of counting, and we have a qualitative approach of how things are represented in the literature or in the debates. Next slide, please. So this is why I'm grateful for the mechanical counting. If we put these terms in together, so I did this, I think, last year, and so I looked at the number of occurrences in the period from 1948, when the NHS was formed, to 2023. So this is how many times these words, crisis and NHS, or crisis and National Health Service, appear in debates in both the House of Commons and in the House of Lords. So, for example, the first line there, if you look at crisis and NHS, over that time period, it occurs in the House of Commons almost 5,000 times, and occurs in the House of Lords a bit under 2,000 times. If we look at the full term National Health Service, crisis and National Health Service occurs in the Commons at just over 1,500 times and a bit over 500 times in the House of Lords. So clearly those words have been used quite a lot in the Commons and Lords over the whole period of the NHS. Next slide, please. Right, you obviously can't see that very well, but I'm sure you can see it well enough to see that these are the number of times the word crisis has been mentioned in debates concerned with the NHS. So as you see this, I'm looking very closely at the screen, and there's practically nothing for the vast majority of the NHS's history. And as we get into I'm going to lean forward now and have a look. We start off a few things about 1990, a bit more in 2000, a bit more in 2010, 2015, and then it really shoots up in about 2020. Okay, almost a quiz show question. I wonder what that could have been all about. But anyway, in the recent few years, we'll look at the different reasons in a few minutes. We have a huge increase in the number of times the word crisis has been mentioned in debates in the House of Commons and the House of Lords. Okay, next slide, please. So just a few patterns from that. In the early years, obviously, politicians in the early time of the NHS called it the National Health Service. But more recently, the term or the acronym NHS has tended to be used. So obviously we looked at both terms. So in the early years, it was National Health Service, the full term. More recently, it's the NHS, the three letters. So what we just seen, clearly there's been a clear increase in the number of times crisis has been mentioned, particularly in recent years. I looked at both the Commons and the Lords. So the term tends to be used much more in the Commons than in the Lords. In the early years, uses tended to be very specific. So, for example, there might have been a debate on pay of GPs or recruitment of nurses. But since then, it's become much broader. So crises have sort of spilled out into the whole of the NHS rather than particular corners or parts of the NHS. Next slide, please. So we're still on the basic content analysis, the counting. In the first year, there were 5 occurrences of the term crisis and National Health Service in the Commons. But actually, so all that does is signal when those two words are used in the same debate. It doesn't necessarily have to be a debate on crisis in the NHS. And in the first year, they weren't. Because if you look at the debate titles, the debates weren't focused on the NHS. So, for example, it could have been a debate on the economic crisis in which the term National Health Service was used. All it's doing is simply pointing out co-occurrences. Any debate in which the two words separated by the and, crisis and National Health Service, were used. So when I looked in a bit more detail, for example, you look at the title, you look at what's said. The first time that I can find, I think the word crisis was used specifically in an NHS context, was in something called the Dentist's Bill in the House of Lords in 1952. So, the NHS lasted a good, 4 years or so without the word crisis being used in parliamentary debates, specifically in the context of the NHS. As we'll see, that wasn't going to last. So next slide, please. So then I looked at the number of occurrences per month. Again, the total in both the Commons and the Lords. So if we look at the shortened version, NHS, the biggest month in which the terms crisis and NHS were used was in March 2020, 183 times. If we look at the longer term, crisis and National Health Service, the figures there were much lower, but again, the same month of March 2020. So as you can see, they all tend to be in recent years. Most of them relate to sort of the COVID period, but certainly the one of January 2023 is definitely sort of post-COVID, if you like. But it does show that all these highest scores were in very recent years. Okay, next slide, please. So if we look at in particular individual debates, then this is simply for the House of Commons. In terms of crisis and NHS, it was mentioned 34 times in a debate in January 2017. So in the Lords, it was 24 times in March 2020. Now, again, most of those, as you can see from the dates, a lot of them tend to be, during the winter period. And so, they're probably related to winter crises. There are a few that are not in the winter period, but the most seem to be, to do with the time of year. The two highest ones just predate COVID, with the highest one being in 2020, third highest in 2023. Again, the pattern is, in terms of individual debates, it's all very recent. Okay, next slide, please. So I'm going to choose one of the debates now and move away from the quantitative counting to look at qualitative content analysis and try to look a bit behind the sort of the words. So I've deliberately avoided the COVID-19 period because that seems to be a rather sort of atypical period. Clearly, in my view, a different sort of crisis caused by a global epidemic than, inverted commas, the normal crisis we'd find in the NHS that's not caused by a global pandemic. So the debate I've chosen is a debate on NHS winter crises, comes from the House of Commons, and it comes from January 2018. So next slide, please. Okay, I have to get used to this now. A bit like the Prime Minister, I have to remember that, of course, this comes from a period in which Labour were in opposition. So this was a motion moved by the shadow Labour Health Secretary, Jonathan Ashworth, in that debate in 2018. So if you just look at the sort of the bold terms here. So clearly it's to do with, his main concerns were to do with the closure of hospital beds, vacancies of posts in the NHS, the staffing of the NHS, the links with social care. So clearly the two are very closely related, that, part of the problem of the NHS clearly relates to social care, and you get that spillover effect. Next slide, please. He continues that more symptoms of crisis as part of this resolution was to do with delayed elective operations. He was concerned about privatisation and concerned about the amount of cash going to the NHS that he wanted to see increased. So that was the terms of the debates. So if we have next slide, please. We can look at some of the more detailed features of it. So as Jonathan Ashworth starts off, he says, a year ago, debated winter pressures. There was that term that the Red Cross came out with that captured the imagination for a while, because you expect the Red Cross really to talk about overseas crises, crisis somewhere else, not in the middle of the British NHS. So the Red Cross came out with this term called the humanitarian crisis in 2017, and Jonathan Ashworth referred to that, and he says, well, here we are again, a year later, debating a winter crisis that's worse than last year's. So it's worse than the humanitarian crisis the Red Cross sort of tried to label. Very clear debate between difference between the parties. For example, at the time, Labour opposition at that time, they definitely used the word crisis a lot. And the evidence they produced for that, they tended to produce lots of national data, number of beds, number of elective operations being cancelled, workload shortage, things like that. They cited experts, clearly experts that suited their case. And a lot of them talked about, obviously, problems in their constituencies, the problem in my local hospital. The Conservative government at that time didn't tend to use or tried to avoid, must have been instruction from the whips, do not use the word crisis. So most Conservative MPs tried desperately not to use the word crisis. They tried to use the word pressure rather than crisis. If they did use the word crisis, then they started to put it in a context. And one of the contexts was, well, crises are not new. The last Labour government, we had crises in the last Labour government. So it's, if we have a crisis in the NHS, it's not only us that's doing it. There were previous examples, including the then, the Labour government, i.e. now the opposition. The other point they made, well, this is a debate in the UK Parliament, although most of it was obviously referring to England. They're saying, well, look, Labour controls Wales, and actually the Welsh NHS has very similar problems. So, clearly the point is don't blame us, or don't blame us alone, because clearly Labour in Wales is also, or is presiding over a crisis in the NHS that obviously they tried to make out was worse than the crisis in the English NHS. The other point they made, particularly with examples with their own constituencies, my local hospital, good local management can actually mitigate the pressures. So very different, coming at, framing, if you like, the debate from very different sides, if you're, Labour, Conservative, government or opposition. Okay, next slide, please. So we're going through our categories now. So this is, again, the Labour opposition. In terms of defining the problem, they talked about finance, they talked about cuts, they talked about waiting lists, waiting times, waiting for ambulances, waiting for A&Es, waiting in trolleys, waiting in corridors, bed shortages, bed occupancy at or near, in some cases over, have more people than beds, over 100%. Cancel services, staff shortages. So again, the point they were trying to make, it's not simply a winter crisis, it's all the year round. In terms of the cause, they were saying the winter crisis is caused by Downing Street. In other words, it's a Conservative-made crisis. And some of the links are to do with lack of social care. There's a bottleneck there. We can't discharge people out of hospital. People are waiting in a hospital even though they're medically fit for discharge. There are structural problems. In particular, they pointed to Andrew Lansley's Health and Social Care Act of 2012 that the Conservatives brought in. That was the one in which the then Chief Executive of the NHS said, this is a reorganisation so big you can see it from space. It's underfunding. The government's doing nothing. They just want to push their ideological agenda of privatisation. Next slide, please. In terms of morality, principles, one of the main moral problems was seen as privatisation. The treatment recommendation was a little more sort of tentative, but it seemed to boil down to we need more money, and as we'll see, an old chestnut of we need more prevention. So next slide, please. So in contrast, the Conservative government framed things in very different ways. So I've said they tried to use the word pressure, not crisis. If there were problems, they were localized. So again, to use that phrase, a little local difficulty. But what they were saying is, well, since 2010, since we came into power with the Lib Dems as they were then, there's been more finance, more doctors, more nurses. We've increased that, more operations, had more operations. Strangely enough, they didn't mention beds, which has actually, of course, gone down, but the others, had actually gone up. So they tried to accentuate the positive. In terms of causes, this was very much, this is not our fault. There are other factors that cause these things. For example, demand, long-term demographic pressures, the aging population. The NHS is struggling because the population is getting older. In terms of demand, admissions to A&E have gone up 20% over the past 10 years. Again, whose fault is that? Is that our fault for misusing A&E? You know, we should be going somewhere else, but we're going to A&E. Is it the GP's fault? Because, you know, people can't get access to a GP, therefore they go to A&E. But the government was almost trying to say, well, if there are factors here, but it's not our fault. It's a difficult flu winter. Some MPs specifically compared it to what Labour experienced in 2009. Problems in the other parts of the NHS, as I said, particularly in Wales, in Scotland, you know, so it's not just the Conservative government that's having problems with the NHS. It's more widespread than that. And in terms of, they use the word crisis in a very different way. So in 2010, you know, this is Labour's fault, they were arguing. It's the financial crisis. Therefore, we had to introduce austerity. I'm trying to think, who does that remind you of? You know, so we haven't got any money, therefore we can't spend it. And they also said money was wasted in the NHS. So lots of things of trying to say it's not our fault. You know, don't blame us for this. There are wider factors that you need to take into account. Next slide, please. Moral evaluation. They're saying the government shouldn't politicise or weaponise the NHS. And a nice phrase about Labour's vote harvesting approach to the NHS. In terms of treatment or solutions, the general argument from most Conservative speakers was that the NHS is already improving. It's getting better. You know, we are making it better. There's more finance, there's good planning. Reforms across the NHS are making a real difference. They claimed there was better integration. They claimed there was more prevention, there was more innovation. And, you know, one of the speakers said, well, I didn't hear anything from the Shadow Secretary today about what he's going to do. Or, you know, it's all very well for the opposition to write checks they know would bounce. So put another way, I suppose there are no easy answers to, you know, making the NHS better. Next slide, please. So a couple of thoughts about conclusions. Again, so in order to determine whether or not we have a crisis in the NHS, clearly we have to define it. And remember, there are those two different ways of defining crisis. Is it simply the problem or a disaster, or is there some sort of problem and solution, the transformation? Can a crisis be short-term? Can it be permanent or almost permanent, endemic? You know, how long can a crisis go on? Questions about, you know, are we getting more crises? Are they getting worse over time? Are things getting better or worse? What are the best indicators? You know, is there a sort of canary in the coal mine that sort of is the best thing to get all crises out in the open, or are there particular things you can point to? You know, for example, is it the number of staff vacancies? Is it the number of corridor waits? Is it sort of ambulance delays? You know, is there a specific way we can particularly look and say we've got a crisis because that indicator is getting worse? I suppose for most people, the standard one would be waiting lists. I suppose that's probably the most usual and straightforward indicator that most people use to say how well the NHS is doing. What is the size of the waiting list and how long are we waiting? In the wider piece of analysis I did, where I looked at both the Commons and the Lords, I think you can see that crises are framed rather differently in the Commons and Lords, but we saw from a few minutes ago that crises are clearly framed very differently by the government and opposition. So I'm not fully certain whether this is what we call a post-2000 crisis. I'll just explain that in a second. If you remember going back to 2000, this was you know, the year of Tony Blair, the phrase that some people might remember, the most expensive breakfast in history. If you remember, Tony Blair came on a breakfast TV program on, I think, Frost on Sunday, whatever it was, and said, you know, apparently without consulting anyone in advance, so the story goes, you know, I'm going to increase the amount of money in the NHS. We're going to increase it up to the EU average. And the great story, whether it's true or not, who knows, is that, you know, Gordon Brown choked on his cornflakes because he hadn't told him in advance about, you know, how much this is all going to cost. So is the current crisis we're in one that can simply be solved by more money, you know, as essentially it was in the year 2000, or is it something that requires more transformation? So on to the last slide, please. So hopefully with the last slide, yep, just bring things up to has to remind himself. We've now got a Labour government, and one of the first things they said was that the NHS is broken, and what we need is the biggest reform since 1948. So what did they do? Well, you could argue they put the band back together. Some of the people who were around advising the last Labour government have now been brought out again. So, for example, Lord Darzi, who's done already about 2 or 3 reports. Darzi was asked to give a report on the problems in the NHS, which he did very quickly, to come out, I think, last month. And that will feed into a plan that the government will come out with sometime next year. Their argument is that we won't just put more cash into the NHS. There can be no cash without reform. So that has in some ways resonances of the year 2000, because the NHS plan from the year 2000 said almost exactly the same thing. The idea we need both cash and reform. So as you could argue that in hindsight, in 2000 we got the cash, but we didn't get a huge reform. And be interested now to see whether we get the cash, because as we know, the government's short of money, or whether we get big reform. The thing that makes me a bit pessimistic is that 1 or 2 of the solutions have been trailed already, and one of them is one we've already encountered. One of the solutions is we need more prevention. And, you know, the idea of the NHS being about prevention was written into the original NHS Act in 1946. It's been trotted out many times since 1946. For example, there was a government document in the 1970s that stressed prevention. Just about every politician since the 1970s has said we need more prevention. But the fact that we keep talking about it, but not really doing that much about it, suggests that it's probably a bit difficult to put into place. And one final little comment that might, I'm sure some people might have a view on this, is that, again, for my money, if you're saying that one of your big things about the NHS is prevention, then my guess is it's probably not a good idea to start cutting winter fuel payments, which is very much an anti-prevention measure, as by the government's, the Labour Party as it was, their own measures. Cutting winter fuel payments could lead to as many as 4,000 excess deaths in the winter. So if you want to do prevention, it doesn't seem to me like cutting winter fuel payments is a really good example of prevention. Okay, thank you.
I'm now unmuted. Thank you very much, Martin. Goodness me, that's a lot of counting. It's quite interesting because I think I vaguely remember, no, I do remember it quite well, actually working with Nigel Edwards in the mid-90s on a when is a crisis not a crisis, which guess what was all about winter pressures.
Yes.
Nothing much seems to change, does it? I've got a few questions. Please do put questions into the chat, and I'll curate those for everybody. But I had a question just to kick us off. Well, in your paper that you've written, which you've taken a lot of this material from, we talk quite a lot about whether the use of the term crisis is a trigger for policy change or not. And one of the observations I wanted to hear your comments on was this issue about the flurry of the term, or the explosion of the use of the term crisis since the 2012 Act. But yet in your words, the lack of policy reaction to it. And when I was reading the Darzi report, I was really taken by the fact that it looked like the NHS had, by stealth, actually overseen what I perceive to be one of the biggest transformations in health in our healthcare system in my career, which is the move to integrated care systems. And although we haven't yet seen the full potential of that, it's actually, NHS 3.0 in my head, but yet it wasn't a national policy
yeah,
political thing. So
yeah,
yeah, just really interested to hear your thoughts about why we've seen such a huge uptick in the
yeah,
term crisis,
yeah, yeah,
and why the politicians didn't react
yeah.
as they previously had done in terms of policy change.
Well, won't be too many of my words. It'll probably be pinched from Nick Timmins, who I think's got a really good line on this. But in some ways, I think that you can, if we take our starting point to be that sort of 2012 Act, in a way, that's a very strange reversal because that's almost a counterintuitive example of a solution seeking a problem. Because, if you think about, the NHS in terms of public satisfaction or most of the sort of objective type of criteria, just before the financial crash, 2008, 2009 onwards, in most of the figures, the NHS was probably about as good as we're going to see. So in a sense, you could argue that it went a bit downhill after 2008 because we were short of money, but you could argue there was nothing fundamentally wrong with the NHS in about 2008. So in other words, it was very unclear what sort of problem Andrew Lansley was trying to fix. So, it's almost reversed the idea of, that rather than a crisis leading to a problem, you had a no problem that led to a legislation that many people regard as causing a crisis. That, I mean, again, someone like Nick Timmins has got a nice phrase in this, a series of workarounds, almost trying to, they didn't want to get rid of the act again because that would be another big reorganization. They haven't got the fingers burnt with the Lansley Act. They didn't want big reorganization again. So it was a series of sort of non-legislation workarounds trying to almost get rid of certainly some of the rough edges of the Lansley Act. And you're right, the idea that the main direction of travel was clearly away from the competition that was clearly at the heart, the engine of the Lansley Act, towards more integration. So as you said, we've got these integrated care boards and we've got various, strict sustainability and transformation partnerships. I always wonder, STPs always have, never know what they mean. But the idea is definitely, whereas some people think, well, wouldn't it be easier if integration was the answer, couldn't we have moved there in about 2008, 2012, rather than going through the Lansley Act and almost then doing a reverse, putting the car into reverse very quickly and getting there via a long route. So
Yeah.
the direction of travel definitely, I think, towards integration at the moment. In terms of crisis, there's that nice phrase, isn't there? Sometimes attributed apparently to Winston Churchill, sometimes to Obama's chief of staff, never let a good crisis go to waste. And so, certainly it has been used a lot, since, as we saw, in Parliament, whether in terms of here's the problem or in terms of the Conservatives saying, look, the NHS has got problems, we have to fix it. And my guess is at the moment, it's almost, that phrase, the NHS is broken, is almost, the word crisis isn't used, but the same sort of function. So means we've got a broken NHS. That means that, we, the Labour government, have to fix it. So without using the word crisis, I think it's the same functions of a crisis. This needs something big that we're going to change.
Yes, I'll come on to comments about and questions about the what we can change. But let me come to a couple of questions from the audience. So we have a question here from Stephen Boxall on the subject of framing. Are we letting our governments off the hook by accepting their brackets fake close brackets argument that there is no money? Our government creates its own funding and is self-funding. Comments?
Yes. Well, I mean, I suppose the starting question, the question prior to that question would be, in a sense, whose money is it? Because obviously some people would argue it's not government money, it's taxpayers' money. But whoever's money it is. I mean, there's a big deficit, there's a big national debt. So, a lot of these sort of standard economic indicators suggest that we are short of money. But in terms of debt, we're not as badly off as a country like Japan that's a lot more in debt than we are. So you're right, at one level, we are as short of money as we choose to be. But again, I think it was a Nair and Bevan quote about socialism being the language of priorities or vice versa. that, when you're shorter, even if you accept we are shorter money, and you may or may not accept that argument, then it's obviously important to use that money in the best sense. And, certainly I've written blogs elsewhere to suggest that, cutting winter fuel payments is probably not the best use of our, if we're shorter money, there are better ways of getting money or spending money than doing things like that, which will cause problems for the NHS anyway.
Okay. And Damien Marmion has asked a question. What is the one constant in the NHS omni-crisis? And who's failed to find the solution? When you've looked at all your analysis, what's that one constant?
I don't know if there is a constant. As I said, in one phrase, that the term crisis is a constant, because you can, for many years, you can say the NHS has been in crisis. Whether it's a different sort of crisis and whether there are different ways of getting us out of the crisis, I don't know. I think going back to a point that we made, perhaps in talking before we started, that I suppose it's one of those sort of things that most people, if you sat them down and said, doesn't prevention sound like a really great idea? It's always better to prevent problems than solve them. So I think, logically, most people would say, yeah, it sounds great. The more we should reorientate the NHS towards prevention, it sounds like a really great idea. But then, of course, the problem comes, well, how do you actually achieve that? And I think that the problem there is mainly in terms of budgets, because while prevention is seen as a good idea, effectively, it's always seen as a good idea using somebody else's budget. And the idea, don't take a budget away from me, because if I'm a surgeon, I need that budget because I need to do more operations. And it's partly, I suppose, the long-term versus short-term as well, isn't it? The idea that,
yes.
You've got a problem now that you have to solve. And that has, I think, two really big consequences for the NHS. So, now pressures are the ones that really sort of drive things. And so that means you put money into, revenue expenditure, paying your staff, paying for the drugs. And if there's a budget to raid, it's often the capital budget. So we'll put off that repair to the hospital. We won't build that new thing, which means that every year, of course, our NHS gets sort of more out of date and more looking a bit sort of, worn, and falls behind other countries. We haven't got as much kit. You haven't got as many scanners. You haven't got as many sort of high-tech things as other countries. So, we're raiding the capital budget for short-term revenue. And another manifestation of that is, clearly, by definition, prevention tends to give you long-term gains. And I suppose if you're a politician in the business of getting re-elected, you want things to get better now. So look, I've got this shiny new hospital that we've spent money and we can point to it. You're not really going to get re-elected by saying that if we, let's say, stop people smoking, that will lead to a healthier population in 20, 30, 40 years' time. So I think there's the difference between sort of short-term political imperatives outweigh longer term sort of, I suppose, logical imperatives, but that's the system that we have.
I mean, I'd hate to sort of put my own views in, but this is so close to my heart. I'm going to, for me, I've worked on prevention area for my entire career as a health and welfare economist. Done lots of economic analyses around the value of prevention, know the relative rate of return is much higher for prevention, even in the relatively short term. And I have never seen this shift to the left that Aradazi called for, again, having called for it several times before. So coming back to sort of Damien's point is who's failed to find a solution. I mean, I think I cannot see how we are going to get investment in prevention until we see it as investment and treat it in the same way as we would capital investment, because the return is so long term. And unless we had some kind of public health investment fund, unless it was treated differently under the fiscal rules, I just don't see how this solution is going to be open to us as a country. So I'd be very much welcome to hear your views on that, and then we've got a couple more questions which we must get round to.
Yeah, I suppose my views. Yeah, I agree, but equally, I'm not holding my breath because I can't see it. I can't see it happening. But yeah, logically, yes, great. You can't flaw the logic, but in terms of short-term politics, it's not going to happen.
Yeah, yeah. Well, let's see how flexible she can be with the fiscal rules. I know she's
Okay.
been
Yeah.
under, Rachel Reeves has been under a lot of pressure from the
Mhm.
Tony Blair Institute. So let's see what happens.
Yeah. Yeah.
Um, we've got Stephen's actually come back with a book that he's recommending that we have a
Mhm.
look at called The
Ooh.
Deficit Myth by
Okay.
Stephanie Kelton. Have you heard of that or come
I
across that?
haven't, no. So well,
Me either.
anything to do with money and economists and whatever. But yeah, I'm sure it's yes, it sounds a good title.
Yep, I'm going to have a look at that myself.
Yeah. Yeah.
And then Gareth Harper, nice to see you, Gareth. And you, Damien. Sorry, I know a few of these people, so lovely to see them all. Um, Gareth's asking, do we know whether our other countries have similar debates about the crisis in other healthcare systems? That's a really interesting question, actually. Are we just obsessed with the
Yeah.
crisis of the NHS in England, or is there something that happens all around the world?
I think it's a sort of nice, straightforward answer of yes and no, because I think clearly there are and have been crises in other countries. I mean, certainly countries like Greece, particularly when the EU pressures, and remember just a couple of years ago about keeping within whatever EU rule they were meant to be keeping within. And they had, I mean, to be honest, the austerity we saw in Britain was nothing compared to the austerity that countries like Greece went through. So, their
Yes,
NHS took a
I remember
real
that.
battering. So, it'd be quite reasonable at that time for somebody to say, yeah, the Greek NHS is definitely in crisis. But I think those tend to be exceptions rather than the rule. And generally speaking, I think, most countries seem to, if you look at all the figures, whether it's to do with, numbers of hospital beds or doctors or waitings for operations or things like that, generally speaking, you don't tend to see, the sort of the crises type indicators that we see in this countries to any great degree.
Mm, mm. Well, it's yeah. The Greek system was really quite shocking. I remember at the time, very devastating. We have a question here from Ian Snelling. One of the issues creating the NHS crisis is a similar position in social care, which I think you
Mhm.
mentioned in
Yeah,
your
yeah, yeah.
commentary. How does discussion of crisis in social care relate to the discussions of crisis in the NHS?
Mm.
Are people really making that connection well?
I, again, a yes and no answer. I think amongst a small and fairly limited number of people are making that crisis because you've got many of the same things. Things that have been occurring over a long period of time. Again, going back to that Blair government, 1997, Tony Blair saying, he didn't want his son to grow up in a country in which old people had to, sell their homes in order to finance their care. So he set up a Royal Commission to give him the answer. The Royal Commission gave him an answer. He found out how much it was going to cost. He didn't like it. And so since then, every politician of every different party has basically almost filed it under too difficult. So
Mm,
it's that same sort of long-standing problem. The reason I think you probably don't see the sort of the more popular discourse of crisis is probably to do with, contact and knowledge. Anybody who tries to ring up for a GP appointment knows how difficult it is. People, know people in hospital. They know people, who've waited for ambulances, things like that. It's
yeah.
really, I think a large part of the problem of social care is that a lot of it's invisible due to, ignorance in the classic sense of the word, that you only tend to find out how bad social care is when it hits you smack on in the face. And there are lots of people who think, oh, social care, it's a bit like the NHS, isn't it? If I need it, I'll just, I'll get it and it'll be fine. And then they find out, well, actually, if you've got more than a certain sum of money or things like that, there's, very clear means testing rules. So actually, you will pay for it,
Mm,
in one sense, a bit like, the American healthcare system, you pay for things. And if you've got the money, you'll pay for it. And of course, sooner or later, you'll run out of money. And if you don't have the money, then it will, there is some sort of means test state provision. So
mm,
I think if people knew how bad social care was, I think there would be a similar crisis. But I think it's that invisibility that's sort of meaning that there isn't that sort of widespread crisis and outcry and, on the front pages every day.
Yeah, and I think as well, it doesn't quite affect the individual in the same way when they're sitting in a hospital bed waiting for social care, as it affects the hospital and their inability to see people at the front door and the impact it has on flow. So yeah, I think that's we had a very interesting ERC webinar last year on funding of social care, which we should really have a revisit of, David. Okay, thank you. And then finally, a comment more from Francis. Nice to see you, Francis. Francis Dickinson saying, presumably we need to talk about the healthcare system, including social care, as health services and care services are so intertwined. And I find myself, this is a bit of a tension, because I often sort of talk about health and care system, health and care, but actually really go back to talking just about health. So, what's your thoughts?
Yeah, well, I'm clear in any sensible system, they would be they are intimately interrelated. I mean, clearly there are, I mean, the example you just used, somebody can be sitting in hospital, they're medically fit for discharge, so they're in an expensive hospital because there's no social care facility for them to go to. So, they are sort of in one sense, but different sides of the same coin. They are related. However, there's those historic decision in 1948 that we will have, the free NHS by a sort of a national sort of body, in a sense, the National Health Service, whereas social care was provided by the local authorities and was means tested, rather than free at the point of delivery. It means we've always had that sort of historic divide between them. I think Frank Dobson, when he was the Labour Minister, Secretary of State for Health, coined that phrase, a bit like the Berlin Wall. So there's always been this big divide between them. And whereas, again, it's a bit like prevention. Everybody says in any rational world, we would have these two systems that would be much more closely related, and there would be easy transfers between them. They'd be operated in a similar way. But Labour is promising, we'll talk in a good game, if you like, the term National Care Service. They're talking about that in Scotland as well, and they've run into lots of problems with that. So one of those things, I'll believe it when I see it, but I'm keeping my fingers crossed to hope that something will get done about it. But again, if I was a betting person, which I'm not, I wouldn't put too much money on us getting a sort of National Care Service that looks and feels very, very similar to the National Health Service.
So I have one last question before we all go off for our suppers or whatever it is we're doing. If you were sitting here in 5 years' time, having updated your analysis, do you think it's going to get worse in the next 5 years in terms of the prevalence of the term crisis when we describe our beloved NHS, or do you think it's going to get better?
I think it'll get a bit better. Partly because I think people might use the word crisis in the NHS a bit less because they might have other things to worry about. So I think I can't see the NHS getting any worse. I don't see it getting significantly better in the short term, partly because the things you were saying earlier on, there are rational, sensible things that, a long-term bureaucrat without any eye in political office might do, but they're not going to happen. So I think it will get a bit better. I think that's the most optimistic thing I can say. It's going to get a bit better.
Okay, well, look, thank you so much for a really interesting talk, and thank you everybody for your questions and reflections. We have two events coming up shortly on the 13th of November after the budget. At the end of the month, we have a leading tax expert, Professor Judith Friedman, who's going to discuss the intricacies of tax policy and delve into the issues either solved or created by the budget. And on the 19th of November, we are going to be joined by Professor Paul Cheshire, who's an authority on economic geography, and he's going to be discussing another very topical issue, which is how housing and planning influence economic growth. So please do join us there if you're able. And thank you again, Martin, for an interesting talk. Yes, on that note, I'm going to close the webinar. So good night, and thank you very much.
Good night.